Everyone. Thank you for joining us. It's Tuesday, January 19th at 3:30 in the afternoon. I'm Brooke Barnes with the Scott County Health Department, and I will be moderating today's press briefing. With us today, we have Janet Hill from the Rock Island County Health Department, Edward Rivers with the Scott County Health Department, and we are also joined today by Tom Bowman, the CEO of Community Healthcare. First, we're going to hear some of our data on case counts from both of our health departments. We'll start first with Janet. Janet, you're muted.
Hi, everyone. Thanks for joining us. We did not report numbers on Monday, so we have 89 total to report for the 2 days, 57 on Monday and 32 today. There are no deaths to report, and currently there are 29 people in the hospital in Rock Island County.
In Scott County, there have been 15,440 cases and 163 deaths. Today, we'd like to give you an update on our immunization of Phase 1A healthcare workers in Scott County. Scott County Health Department at our clinic location and our partners, Genesis, Unity Point Health Trinity, and Community Healthcare at their facilities have administered more than 7,000 doses of vaccine in Scott County to date. This number includes both first and second doses. For the past 3 weeks, our department has contacted healthcare provider groups and scheduled appointments for their staff. Through 5 clinic days, we have vaccinated workers in primary care, urgent care, home health, dental, physical and occupational speech therapy, and other providers. We have appointments scheduled this week for other disciplines and specialties. This clinic model would likely be used for subsequent phases. The state of Iowa expects to move the state as a whole through Phase 1B no later than February 1st. We are extremely grateful for the support of our healthcare partners in the planning and staffing of these clinics. Iowa's Infectious Disease Advisory Council, IDAC, released its guidance for Phase 1B last week. Persons 75 years of age and older were included due to the high number of deaths in this age group. Also included were persons vulnerable to the risk of and exposure to spread of COVID-19 based on where they live or work. Many of these persons live in group settings where their needs are met by workers moving from room to room, or work settings that don't allow them to social distance appropriately. When there's not enough vaccine for all, areas of greatest risk of exposure to and risk of spreading COVID-19 must be targeted. We've received many questions about persons under the age of 75 with existing health conditions. Although the CDC has recommended immunizing those 65 and older with serious health conditions, at this time, these persons are not included in Phase 1B in Iowa. This decision was made by IDAC as a result of the extremely limited supply of vaccine allotted to Iowa. We expect that persons with underlying health conditions will be identified in a later priority group after Phase 1B. Please continue to protect yourself by heeding the advice we have provided. Social distance, wear a mask, and stay away from activities where the risk of exposure is high. We also receive many inquiries daily from other community members asking when their time to be vaccinated will come. Although we are encouraged by their willingness to participate, our response almost always is that we cannot provide an estimate. The reason, again, is limited vaccine supply. Scott County Health Department weekly allotment has most recently been 800 doses. With our clinic model, we can vaccinate hundreds of people a day, but not until we have more vaccine. With over 170,000 people in our county, 800 doses a week makes for very slow progress. With that in mind, we ask that you continue to be patient with us as we administer the vaccine we are allotted.
Thank you, Ed. Next, we'll hear from Janet with a little bit more information for Rock Island County.
I'm coming to you from the Greater Quad City Auto Auction where we are doing our second mass vaccination clinic during this pandemic. As we speak, Rock Island County Health Department staff members are finishing up giving the last of our 1,000 doses allotted to us for this week. This is a Herculean task, and we thank our staff for their stamina and our residents for their patience. There is nothing easy about this vaccination process, from the distribution from the federal government to the state governments to the county health departments and finally into your arms. And this vaccine requires 2 doses, so the process must be repeated. Thankfully, the health department is not doing this alone. Right now, healthcare workers can make appointments at clinics at Jewel Osco online at www.albertsons.com/COVID-clinic. Patients will be asked to show proof of employment, including a work badge, pay stub, medical license, if applicable, or a letter on the employer's letterhead. Jewel Osco is expected to move to Phase 1B next week. The pharmacy has 3 locations in Rock Island County, in Moline, East Moline, and Silvis. The state of Illinois also will announce other partnerships with pharmacies, including CVS and Walgreens soon. However, neither of those pharmacy chains are able to take appointments now. Eventually, there will be enough vaccine in our community to get your vaccine in your healthcare provider's office. We are a long way from that point. We know we've asked for your patience a lot over the last 10 months. I'm asking for it again. Everyone wants the vaccine as soon as possible, and public health and our partners are working at our full capacity to get it to you as soon as possible. We welcome Tom Bowman, CEO of Community Healthcare in the Quad Cities, to talk with us about his organization and how it is helping vaccinate healthcare workers in Rock Island County. Soon, CHC will be able to move to Phase B, which includes residents 65 and older and those in frontline essential jobs. Thanks for joining us here, Tom, and for everything you and your team have done to help us through this pandemic.
Well, thank you, Janet. I appreciate that intro, and it can't be stated enough how much of a pleasure it's been to work with both health departments. Community healthcare obviously operates on both sides of the river, and this vaccination planning has been a challenge, no doubt, but both health departments have been great partners, and we appreciate that. I did want to update on a number of different things. The first one, just on testing, I think it's important that we remember people are still getting sick and displaying symptoms of COVID, and so here at CHC, people can still get tested. We're doing not nearly as many as we were previously. Right now, we're between 10 and 50 a day on average that we're testing, but the patient would need to call our main number at 563-336-3000 and be scheduled for a telehealth visit first. And then depending on their symptoms and the provider's judgment, they'll be directed to a testing site either in our Rock Island location or our Davenport location. So testing continues, and people shouldn't wait for vaccine. If you're sick, you need to come down and be tested so we can isolate as necessary. From a vaccine perspective, we are pretty excited. We will start the 2nd dose for our employees here at CHC, frontline healthcare workers. So we're working through our own staff, and that's been great to get this far down the road on that. And then we're working really in 2 different models because we operate in 2 different states. So from the Iowa point of view, we are working directly, as Ed had indicated, with the Scott County Health Department, with Genesis and Unity Point on the joint operation to do vaccine clinics. We've actually been sending 5 to 7 of our staff members to those clinics to assist, and they have talked and reported back that the processes are very smooth, very efficient, and they really have enjoyed doing it, and patients have been very appreciative. So we're happy to continue to support that effort for the patients on the Iowa side, still in the 1A tier. On the Illinois side, we decided to take a little bit different track. And so we did ramp up our own vaccine clinic, working in conjunction with the health department. So thanks to Janet and Nita and all the staff there who are helping kind of coordinate the vaccine. Right now, those clinics are running on Fridays, Saturdays, and Sundays, Friday afternoons, Saturday and Sunday. It is 100% dependent on what vaccine is available to us, on how many that we'll be able to do each week. We are doing them by appointment, and so this is for non-established CHC patients right now. We are trying to work with employers or groups versus a bunch of individual people signing up individually. So we'd like to be able to continue to do that. So we've reached out to a number, whether it's a school district or other members of the 1B tier, and we're trying to schedule them appropriately versus just opening it up to the public. And then we'll have two different ways to do those that are 65 and older. So patients of CHC who are 65 and older, we will plan to do those through our normal clinic operations, and we'll be able to schedule them into our normal operating hours. And then non-patients of CHC, if you're a part of a group or an employee, if you're still employed, you can work with your employer to get those set up. And if not, you can send a message to COVID vaccine at CHC QCA. That is a email address that we've got where we're taking requests for information about when they could schedule an appointment here at CHC. So basically our takeaways, we want to be part of the solution on the Illinois side. We've ramped up. So far, we've done just over 1,200 vaccines. This last weekend, we did 780 between Friday, Saturday, and Sunday. So we've been able to get a significant number of doses out the door. But again, we prefer to work with an employer group that represents those workers in that 1B category as we open up to 1B. It's all dependent on vaccine availability, so the amount of people that we do each weekend will have to be scaled to what is distributed from the state. And then again, those 65 and older non-patients should email us at covidvaccine@chcqca.org to get more information about scheduling a time to come in. So again, really appreciate working with both the health departments and appreciate the opportunity to speak today. It's been a big effort, and we got a long ways to go, but we're making good progress.
Thank you, Tom. Sorry if I missed my mute button there for a second. We are going to go ahead and go to the questions. So we encourage any media on the call to go ahead and type some in. We do have a couple of questions that came to us ahead of time that I don't want to forget, so I'm going to do those first. A couple of these I believe we may have gone over, and these are for Scott County, so we'll have Ed respond to these. Ed, the first question I have for you is, how does the county feel the pace of their vaccinations are going? Do you feel frustrated by how slowly people are getting vaccinated, or does this feel right on target for the tools the county has been given to work with?
Well, we'd love to have thousands of doses ready to be given, but that isn't the reality of the situation right now. I discussed how many doses we're getting every week. When we get a first dose allotment for a week, it's 800 doses. That's not going to go very far. But I'm extremely proud of the system we put in place for vaccinating our healthcare workers. We've gotten great feedback at the clinic, and this lets us know we can use this as a tool for vaccination in future phases.
Moving forward, does the county have plans for mass vaccinations like we're seeing across the river, and recognizing that there are different states and different practices?
Well, we are doing what you'd call mass vaccinations through our clinic sites for the healthcare workers. We're just scheduling the appointments and not taking walk-ins. But at this time, I see us continuing with an appointment-based clinic process for the foreseeable future. Being indoors has allowed us to remove the weather as a barrier, and it also allows us to expand and reduce the size of the clinics as we need to.
Sorry, just lost my question here. As we see Rock Island County move to vaccinations at pharmacies, such as Jewel-Osco or even private physicians going forward, does Scott County plan on expanding the scope of the administration in the coming weeks or months?
Well, I'm certain that we will, but it all depends on getting the vaccines. We'll continue to look for all options in providing vaccine. We already have help from the health systems, and CHC as we're moving through phase 1A. If the vaccine supply continues To be small will move slowly, but if it happens to increase dramatically, both primary care health offices and pharmacies will be great options to get the vaccine out. It's going to be very hard to split the supply to different groups. For example, the Moderna vaccine comes in large quantities with the smallest allocation being 100 doses. And each vial of vaccine's got 10 doses in it. As soon as a vial's punctured, it's got to be used within 6 hours. So it's not as simple as to give out unless you have people lined up specifically to get the vaccine. That's what we've been using our clinic setting to bring the healthcare workers to.
And then is there anything the county is finding challenging throughout this process that's maybe out of your hands?
Well, if I haven't mentioned it already, our biggest challenge is the supply of vaccine. It's hard when we know everyone wants to get the vaccine to protect our entire community, but we have to do the best we can with what we've got.
Thanks, Ed. A couple questions for you, Janet. Can you give us a rough idea of first doses in Rock Island County, if you have that?
You know, I don't have that readily available with me here outside of our office. And it's a little bit difficult because the federal pharmacy partnership, we don't know exactly how many doses that they have gotten. The state of Illinois is keeping track on its website at IDPH. I don't remember the exact address, but there is a lag. So I would say my best guess is we've probably given out about 5,000 doses, and that anything given to long-term care through the partnership would be on top of that.
Last but not least.
I know you have a little feedback there. Are you able to talk about the partnership with the auto auction, which is where you're at right now?
Sure. Nita Ludwig, before she became administrator, was the emergency preparedness manager. So this is a long-standing partnership that she helped set up. We are really grateful because they have given us use of their facility for as long as we need it. And the reason why we like it so much is that while it's not completely out of the elements, our staff are in garages instead of just in parking lots. So it makes it more comfortable for them to work in these conditions. It's, you know, it's 30 some degrees outside. It's not nice. So we're very grateful for the partnership of the auto auction.
And then would you like to speak, they mentioned maybe some long lines at the auto auction. We know people are very interested in the vaccine. Is there anything you guys are able to do to help with some of that?
Well, phase 1B includes about 65,000 people in Rock Island County. And phase 1A was about 8,000 people. So as you can imagine, our total population is 143,000 people. So this is the bulk of our population, and everyone wants it right now. And I understand that. But as Ed mentioned, vaccine availability is pretty low. I mean, we have 1,000 doses to give out today. And it's difficult to know exactly who's going to show up because it is a mass vaccination clinic. So I will tell you that the last week, the leadership team at the health department went back and did some tweaking of the clinic. We added more staff, including several nurses from Unity Point Trinity who are here helping, and then people from our Medical Reserve Corps. And we added a full lane of people giving vaccines. So I would say that we are going to continue to tweak this process. And as far as the traffic goes, I think people are just going to have to be patient. And I'm sorry to keep asking for that.
Thanks, Janet. Ed, we have one last question for you here. And this was why incarcerated individuals are included in phase 1B. Do you think you could expand on that risk of exposure and risk of outbreaks in the community on that a little bit?
Yes, it's my thought that there are two reasons that prisons or incarceration facilities were included. I'll answer the question a little more broadly than it was asked. It's critical infrastructure. They have to continue. We can't close them down. So we have to have people to run them. Therefore, the workers in the prisons are immunized. Also, across the nation where there have been outbreaks in confinement facilities, there have been a large number of deaths. Often people who are incarcerated have multiple health problems. We see it here in Scott County at the health department. We're responsible for providing the care in the Scott County Jail, and it's both an arduous and an expensive proposition. So on both sides of the equation, both the workers and the inmates, they need to be protected.
Okay. I don't see any additional questions, so we'll go ahead and conclude for today. Thank you, Tom, so much for spending some of your time with us this afternoon. We're grateful for your partnership on both sides of the river. We couldn't do this without all of our partners. Thank you to the media again for joining us and for sharing this information. We know that there's lots happening between our counties and states, and so we really rely on your support with sharing some of that to our community. Our message will be posted on the Scott County Health Department's website, as well as on our social media pages, so please check there. And then we look forward to talking with you again, hopefully later this week. Thank you, everyone. Have a good afternoon.